Hi, my name's Jennifer Blakeney, and I am the Women's Health Specialist at Sterner Physical Therapy, and I just wanted to present a short video on strengthening and relaxation of the pelvic floor. This is meant as a review for patients I've worked with, but others may find this helpful as well. The goal is to remind you of the strengthening and relaxation techniques for the pelvic floor muscles. They will help with general relaxation, pelvic floor pain, and muscle weakness leading to urinary and fecal incontinence. So let me first start with a critical part is the breath. When we breathe deeply using our diaphragm and minimizing the use of our shoulders and the upper respiratory muscles, we give ourselves the benefit of relaxation. This is the first important step in all pelvic floor exercises. So try to get aware of your breath low into your lungs so that your lower ribs expand with your inhale. So your shoulders should stay pretty still and your ribs should expand really 360 if you can. Let the air fill deep into your lungs. Breathe in through your nose and let the air out. Don't force it, just let it out. So you can practice that throughout the day, especially when you feel tense. Now I'd like to give you a little background on the pelvic floor muscles, to which I'll be referring. I don't have my model with me here at home due to closing for COVID-19. So I'll use my hands to simulate a pelvis. So if this is the pelvic ring, and you can imagine that the pubic bone is here, and the tailbone and the sacrum are here. So in between this space, there are muscles, and the muscles go around the urethra, the vagina in women, and the anus. And those are essential muscles that help control our urine flow, our passing of stool, and are important, and the tone of those muscles are important to our posture and the position of our pelvis to prevent prolapse, for example. So as you sit in your chair, you may imagine that the pubic bone will not touch the chair, but the tailbone and the sit bones are on the chair. So sit up straight with your feet flat on the floor and feel your sit bones and your tailbone, and imagine your pubic bone just above the chair, just resting there. And as you breathe, the breath, you imagine, as you inhale, imagine the pelvic floor also expands like your ribs, and let the pelvic floor muscles there, that sling at the base of that ring of the pelvis, drops into the chair. So let yourself try a few breaths of just breathing and expanding the pelvis, the pelvic floor, into the chair, and imagine that the ring is expanding. There won't be much motion, but just imagine that. Now, the opposite is the contraction, and you can imagine those bones coming together. Let yourself feel, use the muscles to pull the bones together and close off the sphincters around the anus, the urethra, and the vagina. And as you inhale, feel the relaxation, and as you exhale, feel the tension and feel the muscles, the sphincters close. So that takes some practice to move with the breath. So again, it's inhale, pelvic floor relaxes. Exhale, pelvic floor comes together. So you can try that again throughout the day for pelvic floor awareness. Now if you have tension in your pelvis and it hurts, for example, on sexual intercourse or insertion of a tampon, then making sure you really do that relaxation part is critical, and you want to minimize the tension part. So please make note of that the relaxation is the key if you are experiencing any pelvic pain, as well as urge incontinence. Sometimes the bladder gets irritated when the muscles are tight. Okay, so for those who aren't having that pain and tension so much, I want you to go back to the idea of the pelvic floor contraction. So as you're sitting on the chair and you're imagining the muscles pulling those bones together and closing off the sphincters. And you can hold that for 3 to 10 seconds. Again, depending on your strength, you should feel that strength, that contraction, close and relax. And take as long as you need to feel that relaxation. That's a very critical component of muscle strength. So you can also isolate the contraction. You can isolate just around the urethra, just around the anus, just around the vagina. So that's another piece you can work with. So now I want you to try, if you feel ready, to close all 3 sphincters together and then lift as if you're lifting an elevator. Lift up, really rising as if you're rising the pelvic floor muscles off of the chair. And you can hold that again for 3 to 10 seconds, depending on your strength and your tension. And then relax all the way. And you want to do 3 to 10 of those a day. Or 3 to 10 in a set. And you can practice them 3 to 10 sets a day. Another important exercise, the muscles component, is what's called, we call the quick flicks. And that is especially important to stop urine flow when you're not quite to the toilet. So you're going to contract quickly and relax quickly. So lift, or squeeze really, more than lift. Squeeze and relax, squeeze and relax. And you want the peak of contraction to come straight up and straight down, versus the other, the longer holds are coming up maybe quickly and holding there and then dropping. So the more control, the better. Okay, so those are, you're sitting, you can do them in lying, lying down, lying on your stomach, lying on your back, and standing as well. So now I'm going to do some standing, more advanced exercises.